It's What's the Health. I've got a very special guest, Dr. Greg Nigh. We go way back. In fact, Dr. Nigh and I started this clinic here at Nature Cures back in the day. So I am so excited to have him on. He's a little bit bashful today, so we're going to hear his voice, but that's really the gold is in his voice. So I want to welcome you on, Dr. Nigh. Welcome to What the Health.
Thanks so much. Yeah.
And we go way back. In fact, if you all YouTube us, you can YouTube Nature Cures the Health Chat, and you can see us back younger selves about 20 years ago.
Back before it was cool.
It was way before it was cool, and before we knew what the hell we were doing with this stuff. So we're getting back at it. Yeah, before anybody had this stuff figured out, we were out there. Basically, it looked like two guys down by the river, doing the health chat. So I'm super excited. Dr. Nigh, you have been at it over at Immersion Health here in Portland, Oregon. One of the things, I'm giving you much bigger fanfare than I know that you would ever do or maybe even feel comfortable with, but I don't mind giving you props because I feel like you're one of the, brightest minds in medicine these days. And I'm super excited to talk about what you've got going on with cancer care, and then you're always up to kind of the latest, greatest, and cutting edge thoughts in science and what we're doing in this medicine. We're going to cover a lot of ground, folks, so I'm super excited. Maybe give us a little update give me an update on, what you've been up to over there at Immersion Health. I know you've got an integrative clinic. Your, focus is on comprehensive cancer care. What are you up to?
What am I up to? I am, this, that, whatever. I do probably about, I'll say 70% of my patients are cancer patients. All kinds, all stages, all that. So those patients are, after the initial evaluation, they generally are getting on really pretty intensive programs with all kinds of stuff that we got going on here. And then, the rest of the patients are, I'm kind of a little bit back into treating more Lyme disease. So treating just chronic Lyme and mold illness and, just kind of the chronic stuff that we do.
Yeah, they're kind of difficult, recalcitrant. Got it.
Yeah.
So how do you set up, how do you set up because I know, are you finding better results or, I know you're treating whole people and that's kind of the magic of what you're doing. Are you having, certain ones that you think, wow, yeah, we've got this one down, or are we at that stage yet with the kind of metabolic treatment of cancer? Or what's your thought process on cancer in general too?
Well, I think, I would say, well, first of all, there is no alternative cure for cancer that it's just not, we're not there. I wouldn't say that, I feel like it's this constant creeping closer and closer to the kind of program that for most people will transform it into more of a chronic but livable condition. And by being chronic, I don't mean that I mean in a way that it's just there but not doing anything. It's not, often people are out living their lives and doing fine. You don't commonly get complete regression of tumors. That just doesn't happen. But you do get, it's funny. Cancer is not a problem if it's not growing. It really is only dangerous when it's growing. And that's true even of metastatic cancer. If it is just sitting wherever it is and not growing, then people can live their life and they, whatever, they can do what they do and not have to worry about it. It's in the growth process that it becomes destructive. And so I mean, of course, the first goal is always to get regression and remission and all that, which is awesome when it happens. But that's not always feasible. But it's a really good second place finish if you can just stop the growth. Because once you stop the growth, then it's the next best thing.
Got it.
So
yeah.
Yeah, I do feel like, I mean, certainly my approach is a metabolic approach. I'm utilizing a lot of therapies that try to interfere in various ways with the metabolic pathways. I'm now incorporating a lot more of repurposed medications that also, the most common one we think about is metformin, which has gotten a lot of press as one of the cancer therapies. But there's this whole, it's a very kind of well-researched set of studies now on the use of various other medications that are relatively non-toxic in their normal prescribed use, but they have quite significant impact on malignancy, and especially in that they block various pathways that are necessary for malignant cells to utilize. And so certainly using all the natural stuff, but also when it's appropriate, bringing in some of those other medications that they're a little heavier handed than the natural, but certainly dramatically less impactful than chemotherapy. And so, I think it's still kind of utilizing the least force necessary to accomplish the goal that you're trying to accomplish, which is bring it under control.
Totally. Do you have a way of, I'm guessing it just depends on how far advanced, what type of cancer, what their kind of platform that they're coming in with, to assess, like, okay, when do we go to these more bigger guns, so to speak, rather than more natural therapeutics or some combination, or is it all kind of full court press right from the get-go with everybody?
No, well, it's definitely, no. I mean, it really, what changes is how it's predominantly using the same set of tools, with, I would say 70% of therapies that get utilized are utilized with everybody. And then there are some things that you're going to do uniquely if it's a hormone-based cancer, and depending on the hormones, or there's other things you do uniquely if it's a brain cancer. And, so different things become unique depending on the cancer, but that's a relatively small set of the total program. And then what changes is in the intensity of that program. So, if somebody's a stage 2, typical scenario, a woman has come in and they found a lump in her breast and she goes in for lumpectomy, and then they do, chemo and radiation. Typically they're going to do in that situation. And she wants to have complementary therapies to help it all go well and help to tolerate it. And so in that scenario, I'm not doing the intense, 5-day-a-week treatment program, because they're already doing chemo and radiation, and that doesn't need to happen. However, I do have sometimes where, okay, maybe woman stage 3, and she gets a lumpectomy but refuses chemo and radiation, which is that's not uncommon at all. And in that situation, I'm absolutely doing a very intensive program, because the whole point of doing chemo and radiation after lumpectomy is the assumption that there are still some cancer cells laying around. And if that's true, there's never going to be fewer of them than that first visit that I have with the patient after the surgery. And so the sooner that we can get started with an intensive therapy, that's our best chance to squash whatever remaining cells there are. So the intensity of the program is definitely based on the situation of the patient.
Sure. And I guess one level, one meta spot above, because I kind of launched in, because I have a basic understanding of what you've been doing. But for those that are new to this discussion, like your thought process around cancer care is a lot different than a conventional doc. So, your foundational thought process, like kind of what you led with around, you can just manage cancer like diabetes, basically. What is that? Because that's a lot different for a lot of people that come to this diagnosis, getting the dreaded C word.
Sure. Yeah. Well, yeah, I do. I personally think the conventional model of cancer and understanding what cancer is, I think it's just totally wrong. The notion that cancer is fundamentally a genetic, that is the conventional model, that there's these somatic mutations that come up and it makes cells start dividing. And I mean, there's so much evidence to suggest that that's not how it happens. And in fact, the mutations are secondary. They come on later after some metabolic things have changes in the energy utilization within the cell start taking place. And once certain metabolic pathways get established over time, those pathways lead to a greater accumulation of free radicals, which then start damaging DNA, which then, so now we have mutations. The fact is, this whole idea of genetic-based cancer therapy is so ludicrous. They have taken, in any given tumor, if you take a cancer cell from different places in the tumor, there can be up to 100% difference in the mutations that those two cells have. So how do you design a therapy based on mutations? It doesn't make any sense.
Yeah.
So yeah, the logic behind what therapies to utilize are based on the kinds of metabolic changes that are happening. Now, I personally also believe that that infections are a very significant driver of the malignant process, and so mycobacteria in particular are this very sneaky subset of bacteria that I think there's very strong evidence that they are very highly associated with many different kinds of cancer. And I think that that's why that there are some anti-infection type therapies that have quite good efficacy as cancer therapy as well. And so, there's a lot of crossover there. Many of the kind of therapies that I'm using are really focused on their antibacterial effect.
Interesting. And is that more of a molecular mimicry, or is that an activation, do you think?
That would be an activation. So it would be mycobacterium would infect a cell, and as part of what it does inside the cell is to sort of hijack its molecular machinery and shift its metabolism into, glycolysis and some other types of pathways that promote the malignant process. And so, yeah, you got to kill the mycobacteria inside the cell, which will either, if it's an early stage in the process, the cell can then just revert back to normal. It redifferentiates. If it's too far down the process, then it would just kill the cell.
Got it. So on that front, are you dealing with, why do you think some people have more susceptibility then to that happening?
Well, I think modern life, it's really, I'll say I will have to say that at this point, having seen the number of people that I have, and of course my patients I have this selection bias because patients, the ones coming to me are the ones who see naturopaths when they get a cancer diagnosis. And so they are the people who have generally, probably on average, lived healthier kinds of lives the people who just go to their conventional doctor. That said, it has been shocking to me how many people have shown up that in doing a really in-depth kind of excavation of their health history and their exposure history, I can find nothing that would explain why they would have a stage 4 cancer. Yeah. And of course, almost everybody comes in with that question: why did this happen to me?
Right.
And I mean, sometimes you can say, oh, well, yeah, this person smoked for 35 years. And so then you can say, well, it was the smoking.
Right.
But I've had so many people that don't have any kind of risk like that. I mean, actually, this is not an exaggeration. There's one patient in particular that stands out. She grew up in Canada, out living on an organic farm where she remembers as a kid just like doing Tai Chi in the yard and did meditation with the. It was
right.
like a ridiculous parody, and eating all organic, everything. Completely crazy how clean this person's life was, and showed up in my office diagnosed with stage 4 breast cancer.
Wow.
Like, I don't know how to explain that.
Yeah. So
it's like, I don't spend too much time. If there are obvious, of course, if somebody has obvious metal exposures or we know that there are various, Epstein-Barr virus or whatever kind of things, of course we address those. But I really don't spend too much time trying to figure out why somebody has their cancer. And sure. I also try to orient people away from that question, because people can hold on to a lot of guilt about various things that they might have done that led to the diagnosis. And I mean, it is a mystery to me why many people get their diagnosis.
So on that front, like on the mindset, what are you doing for folks on mindset or around that? Like, so you're steering them consciously of like, that's a quagmire. We may never be able to answer that. There's not really any rhyme or reason here. What do you have on that mindset piece for folks, or maybe recommendations for folks that are watching that have a cancer diagnosis? What do you share with those folks?
Well, I essentially relate something like I just did to explain that there are too many variables in this world now for us to tease it all out as to what might be contributing. I mean, the exposures that we have, the chemical exposure, this crazy ocean of electromagnetics that we're all swimming in all the time. There are an increasing large number of risks that we can no longer mitigate. I mean, we can mitigate the risk of, like how much sugar we're eating. We can mitigate that. Or we can mitigate how much exercise we get. But we can't mitigate, at least not in any significant way, the amount of exposure we get to electromagnetics, because we do what we can, but there's just so much you can't do. And so my work with people is really the productive work is getting engaged in the changes and the therapies that are going to move them in toward feeling better and wellness. And that's all we do. And if there's something obvious, if there's something very clear that we need to work on, like, I've had, probably 3 or 4 patients who were certified herbicide applicators.
Wow. So
their whole life, they've been spraying Roundup, just always around Roundup. And, lo and behold, they have liver cancer. And so there's certain, if you got an exposure like that, okay, well, you have to address that. But for the most part, I really, I just want to keep people away from those kind of negative spaces around why did I get this?
Kind of the blame game. Yeah.
Yeah, totally.
What does some of that, so just on the Roundup components, does that touch on the Stephanie Senoff work that you've been doing, or like what's happening in that sphere for you?
Oh yeah. Well, yeah, I mean, yeah, so with Stephanie, we had written a couple papers in the past. And of course, anytime you're working with Stephanie, you got to be researching Roundup or glyphosate because that's her gig for good reason. So yeah, and that is, I mean, that's another interesting, we had one on the relationship between glyphosate and how it causes gout and some other related diseases. And then she and I wrote one about the link between glyphosate and anencephaly, infants born without brains, and there's a strong link there. And then most recent, there's just we finished an article. It was about, I don't know, 3 months ago. We completed an article. Actually, this is a little bit of a story. If you're interested in politics and medicine, I can.
Totally. It is called What the Health.
Right. Yeah. So it was an interesting situation because it was I'm going to mess it up. I think it's a Journal of Molecular Biology or something like that. But it was pretty good. It's one of those well-respected journals, and they were having they were doing a special edition like journals do, and they were doing a special edition of the journal that was on what's called interfacial water, which is water. Interfacial water is water kind of at the boundaries of, at cell surfaces, and water that comes up against any kind of membrane or anything, because water, when it gets up against those kind of membranes, it forms a structure. And that structure, water at these membranes, has a very unique biological role that nobody really understands, and nobody really understands how it happens. And so I got this guest editor sent me an email and asked me if I wanted to submit an article to this particular edition about interfacial water. Anything that I really wanted to say about it, kind of exploring where it comes from and what it does. And so, I said, sure. And he said, you can feel free to collaborate with somebody if you want to do that. So I reached out to Stephanie and I said, I got this invitation. What do you think? Can we put something together? And she was psyched about it. So we wrote this article. And personally, I think it's a really great article. I had a lot of fun writing it because I learned a lot about how water structures itself in the body, and the role of sulfur and glutathione and B12, and how they all kind of play this fundamental role in keeping water structured, which is critical for health. And then one of the sections of the paper, we talked about some of the things that will cause water to destructure. And well, lo and behold, glyphosate does that. And so we had a section about how glyphosate really significantly degrades the body's capacity to organize water. So, all right.
Wow.
So we wrote this article, and, it seemed like, I felt like it was a good article, and it was saying something unique. Like the whole point of this guest journal was, offer ideas about how this structured water happens, because nobody really knows. So we wrote a paper that explains how it happens, like the whole way that it's. So anyway, so we submit the paper, and initially I got an email that said, thank you for the submission. Great, we'll be in touch. And I got to remember exactly how this went, but at some point I got the word that the paper was accepted. And then about 3 days later, we got a rejection. And it was like, what?
Yeah.
And so I wrote back and said, I'm just curious here, because I was invited to submit the article.
Right.
And I'm wondering how this happened. Like, why did I get, can you give me some, because they didn't give any feedback. There were no comments whatsoever. They just said, we decided it's not right for the journal.
Huh.
And so I wrote back and said, I don't really understand. And the person who sent the rejection, said, well, I can't really tell you any more than that. So I wrote a letter to the editor, the guy who had initially contacted me, and said, I'm wondering if you can just tell me what's up with this, because I thought we were doing what you had asked, you know? And he said, I don't know. When I got the article, I looked it over and it looked like absolutely what we want, and I approved it and I sent it on to the reviewers. So as far as the editor knew, it
was accepted.
It was totally accepted.
Yeah.
And he said, I'll look into it. And then I got a letter from him a couple of days later that said, this actually came from the like the editorial board of so there's the parent company that owns a lot of different journals. And so this was one journal. And so he said that it was members of the board of the parent company that saw that article and said no. So it wasn't his decision not to do it. He got overruled and wouldn't allow, they said you can't publish that in our journal. Wow. And the only reason that would have been overruled is because it had a section on glyphosate.
Right.
Because Stephanie has had trouble publishing in a lot of peer-reviewed journals because that's what she does.
Wow.
So yeah, it was so anyway, we're getting it published. It's in another, it'll be coming out in another journal, but.
Oh, great. But it's not in the one on structured water. So, wow, right. So censorship abounds. So that was the parent company that basically squashed the editorial review board of the magazine.
Overruled the guest editor of that edition.
There is, it's almost like we're needing, kind of that repository for the truth out there, right? We're seeing that even in just Google's algorithms towards more natural, integrative, functional, naturopathic websites, where they're basically wiping the word off the internet. So, that's, I guess, maybe encouragement for folks to share what the health and, visit these websites. Dr. Nigh, will you say your website out loud?
Oh, yeah. It's Immersion Health PDX. IMMERSION. Yeah.
Perfect.
ImmersionHealthPDX.com.
Great. And we're going to have that in the notes, but also just a reminder, if you're just tuning in now, this is Dr. Greg Eckel and What the Health podcast. I've got my esteemed colleague and guest on here, Dr. Greg Nigh. And, one of the things, this component of censorship is huge. Two weekends ago, got to sit down with Joe Mercola, of all people, at Mercola.com. And he basically, whether it's a conspiracy theory or not, what we're hearing more and more is, no, this is not a conspiracy theory, folks. You got to know where to go for the right information. So if you like this information, please share it with your friends and family. That was one of the purposes of bringing the podcast back out to life, because these voices like Dr. Nigh's, they're not being heard out there. And this is some stuff that can really change the trajectory of your health, your family's health, your neighbor's health, your community's health. And so, that leads to so many other discussions. I'm wondering, though, you touched on this sulfur, and I know that's been a big piece of your work. How it gets messed up. Why do people care? Why should we care about sulfur? What's the, in the lay public terms, what is going on with this?
What's going on with sulfur? Yeah. Oh gosh, let's see. So the short answer, to tie all this water and sulfur thing together. So basically, water in the body has to be structured, or the large majority of it is structured, meaning every time water comes up against a negatively charged surface, it will organize itself millions and millions of molecules thick, a layer of structured water. And this is seen on imaging. This is not naturopathic ideas. This is totally well established. So whenever water hits a negatively charged surface, this structuring happens. So as water forms this structured layer, very thick layer, it is what happens is that the water, because these rings of H2O, they form hexagons and they share hydrogens. And because they do that, it means that there are excess hydrogens. So those excess hydrogens get exported outside of the structured layer. So the structured layer is now negatively charged, and the water just outside the structured layer is positively charged because it has this accumulation of hydrogen. Whenever you separate charge, that's a battery. And that battery is usable by the cells of the body. Now, that structured layer of water is critical for health. It regulates the exchange of ions that move through it, regulates the nutrient travel, it regulates all kinds of things about the health of the cell. So, keeping in mind that that layer is built whenever you hit a negatively charged surface, the next question is, where are the negatively charged surfaces in the body, and what brings the negative charge? Well, it's sulfur. Sulfur provides the negative charge on the surface of cells. On all of our surfaces are covered with heparan sulfate, which is the most densely negatively charged molecule in all of biology. And very smart, our bodies put that molecule, heparan sulfate, on everything. All of our surfaces and cells they're just a forest of heparan sulfate, because these heparan sulfate molecules are stuck to, I don't want to get too technical on this stuff, but stuck to glycosaminoglycans, which are those are the connective tissue that fill the spaces of our body. They're everywhere. So sulfur is built into heparan sulfate. Heparan sulfate is a densely negatively charged molecule. Surfaces get covered with heparan sulfate, giving the negative charge that allows water to form its structured layer. So if anything impairs the ability of our bodies to create heparan sulfate, meaning we have to have a supply of sulfate all the time. Now, we're not eating sulfate. Sulfate doesn't come in our food except in trivial amounts. We have to have the machinery inside to turn dietary sulfur into sulfate. There are lots of things that happen that impair our ability to generate sulfate internally. And if we impair our ability to generate sulfate, we have to get a workaround. Our bodies have to come up with another way of getting it. And the way we do it, for the most part, is that we grow bacteria in our guts called sulfur-fixing bacteria. Those bacteria generate other compounds, other sulfur compounds, hydrogen sulfide and sulfite. Those compounds cause lots of symptoms, but they can be turned into sulfate. So it's the body doing something that doesn't make us feel good, but it's a way to get the sulfate that the body needs.
What kind of symptoms do you see with patients with that issue?
Oh, gosh. I see there are many, sorry, I'm getting a distraction here. So the kinds of symptoms that come up are certainly SIBO and irritable bowel and Crohn's and all those sort of things. Digestive symptoms, absolutely. But also the symptoms that come up with excess hydrogen sulfide in the body go to everything, dermatitis, any kind of skin conditions, hot flashes, unbelievable. I seriously, it's like I have had perimenopausal women go from 30 hot flashes a day to 0 once we get the sulfur working in their system. So awesome. Heat and just night sweats or hot flashes, absolutely. Brain fog, anxiety, panic attacks, definitely sulfury.
Wow.
Yeah, so it's kind of across the board.
And do I understand you have a book coming out on this?
Funny you should ask. Yeah. I do. In fact, I just written a book called "The Devil Is in the Garlic," and
nice.
it kind of lays the whole thing out from the role of sulfur in the body and this whole water structuring and how it gets messed up and how to fix it.
Cool. That's great. That is going to be such an awesome resource for folks. So, because I know this has been one of your passion, almost obsessive thought processes, and it seems like for good reason, right?
It's been
that's
a while.
Awesome. That is awesome. Okay, so we talked about, where can people find out about your book? From your website? You have like a pre-order form?
It's actually just, it's all in process right now. I think it's going to come out in mid-October, I'm guessing. And so, absolutely. It'll come out, the website, and there are a couple of other outlets that I think will be picking it up and kind of promoting it. So hopefully it'll be out there.
It'll be everywhere. Good. All right.
And then the motion picture will follow.
I love it. Yeah. Devil is in the garlic. So that sounds awesome. What about, so I guess we did cover, but I want to come back because this is so rich and I love talking with you, Dr. Nigh, on the imprinting. So we're talking about, all of these things kind of interrelate, right? You've got the structured water, you got sulfur metabolism as a piece that's essential for that. You got the environmental toxicity of glyphosate and other substances that impair that system. And then you have just water and structured water and water molecule in and of itself as, the structured medium to imprint medicinal substances on. So that was one component I wanted to weave in here. You said you're really into talking about that. How does this play a role then?
It is. This is. Let's see, a little bit of backstory on it is that. So every year I go to. There's the most awesome conference that there is the water conference, which happens every year in Europe. It's in Germany this year, but it's some of the most radical research. It's really incredible what some people are finding about the unique properties of water and how it can store and transmit information. And really, it's an incredible conference. And this year in Germany, Stephanie Seneff and I will both be talking at it this year, talking about various aspects of sulfur and water, because that's what we do.
Awesome.
So anyway, it was somebody I met at this same conference that about 3 or 4 years ago when I was there, who had developed a system of basically making a audio copy of the information. So if you put a substance in water and you shake it up, it will impart an electromagnetic signal to that water. Now that part is not controversial. That's established. So you take some antihistamine, you put it in water, you shake it up, that water will retain an electromagnetic signal. You can record that signal and you can play that signal to another container of water that doesn't have antihistamine in it. You play that signal and now that water will retain the signal. It will absorb and retain the signal that you just played it. In this case, it was a signal generated by an antihistamine. Now, if somebody has allergies and you say, hey, drink that water, and they drink that water, their body responds as though they took an antihistamine. The signal is conveying the information of the substance. And so this
is that homeopathics? Are you talking about homeopathics?
It's very similar to that. We could say, it is homeopathic in a way. It's not done exactly like homeopathy is, but it is in essence the same thing. It's capturing the information of the substance, whatever it happens to be.
Wow.
And so I then, kind of got to start, I was really interested in this whole system. And so I started working with the company. They're in Canada now, used to be in Bulgaria, but now they're in Canada. And I am one of the people who I make these digital copies. I got the equipment at home where it's all in the computer, and I take whatever substance I want, and I can put it in water and shake it up and turn that into an audio file. And so you create an audio file from the substance, and then it uploads to a database. And now there are, I don't know, probably 200 different things, medications and herbs and vitamins and all, Bach flowers and homeopathics and all kinds of things that now have a digital copy that there's what's called the IC. IC stands for information copy. So there are IC pads that you just plug into your computer's audio port, like your speaker jack.
Yeah.
And then you set your water on the pad and you click the substance you want to download, and it will just print it to your water.
Wow.
And you can drink the water. I mean, it's really shocking. I mean, it works. It actually works.
Yeah.
I mean,
that's really cool.
I've actually had 2 dogs now that had ear infections, 2 different dogs who had ear infections. And we just printed antibiotics and antifungals to some water and just had them drink the water. Overnight, cleared up their ear.
Wow.
Totally gone. Yeah.
Sweet.
But also a number of other, lots of stories to tell about that stuff.
Indeed.
Yeah.
I mean, that sounds pretty radical. So transmitting substances, radio frequency of the substance to a pad that then imprints it in the water. Now, do people have to use a specific type of water, or what kind of water are we talking?
No, you don't. Of course, I'm recommending people use specific water. There's not really a well-established method for creating structured water that you can drink. The guy who does this research is Gerald Pollack, who wrote the book Fourth Phase of Water. He's the guy who runs the conference, the water conference, and he said he has a lot of people send him samples of water to test it and see if it's got the properties of the structured water, or what he calls EZ water, which is exclusion zone water. And he hasn't really found any that are consistently high in that form. But I actually think that's okay. Like, our bodies are made to structure water. I don't think we really need to be drinking structured water. We need clean water. We need, pure water, but we don't need it to be pre-structured, because as long as our sulfur metabolism is working the way it needs to, we are very well designed to structure water. So really all we're doing is adding information to the water so that when it comes into our body, it is simply like bringing in a set of instructions for cells that then, the cells will incorporate that water in the way that they do, but now the water is it contains a little package of information.
Wow, that is so cool. That is so cool. And so when's you're going to that conference next month, October over there, you said?
Yeah, it's at the end of October, yeah.
So you've got all kinds of new information coming. What's the topic of your talk over there?
My talk, I am making the case that that cancer is one way of understanding cancer is the body's attempt to compensate for a lack of adequate sulfur. Mm-hmm. In other words, it's the most extreme example of cancer. A tumor is a little factory for sulfur compounds. They generate lots of sulfur compounds. Many genes related to sulfur metabolism are upregulated in cancer cells. And there are many stage 1, even stage 2 tumors that they arise and then they go away without any interventions. This is now really widely understood that stage 1 and stage 2 cancers are quite common, that people will have them show up and then they go away. And so what do you do if your body it loses access either locally or systemically to adequate amounts of sulfate? Well, you have to generate hydrogen sulfide because that's the next best thing. You can convert hydrogen sulfide to sulfate. And that's exactly what cancer cells do in huge amounts. And so you can set up shop and just generate some and feed the local tissue. And when you meet the needs, you can close up shop. You don't have to have it anymore.
So it could be, oh yeah, keep going. Yeah.
But, well, it's just that if you don't meet the local need, or if there's a systemic interruption and there's an ongoing need for these sulfur compounds, well, you might have to build a bigger factory. You might have to set up shop over there too. You might have to,
I mean, in essence, you're saying maybe the cancer is a compensatory mechanism for the sulfur deficiency, or so it's the body trying to heal itself.
That's exactly what I'm saying. Yeah, I think I absolutely recognize that there are things like asbestos causes cancer, and that's not necessarily a sulfur problem. Or this is not necessarily the only reason people get cancer, but I do think that it is one possible lens through which we can understand some cancers.
Definitely turning that stone over. That's a big component. Well, I mean, so that touches on kind of a bigger, again, a meta level discussion around kind of the understanding of health. And, you kind of put out a little bit in our notes about vitalism and cosmology. I want to stick to vitalism with the thought process of, I know you were writing a chapter in the naturopathic principles on the VIS, which is a whole new concept. I mean, I'm bringing it up kind of late. We're coming down to the last quarter of the show here on What the Health. But, so I'm just kind of opening the door. Maybe this is something that we discuss on a further future podcast down the road. But it kind of seems like it segues really well right after this concept of, well, maybe some portion of this disease process is a compensatory mechanism of the kind of vitality of the individual trying to heal itself. So, I'm going to lob that over to you.
Well, I think, it's like, especially in the naturopathic world, we certainly understand things like fever. Fever is an adaptation. It is an attempt to restore equilibrium in the body. You gotta go through the fever in order to reestablish equilibrium. Or any kind of, we understand the same thing about any inflammatory process, that it is the body's way of reestablishing balance. But then, to some extent, we can also get to that thought in thinking about more chronic type illnesses, that somehow it is simply the body's chronic attempt to reestablish the balance that didn't get reestablished in the short term. It's kind of that whole naturopathic model of insult, and then if it doesn't resolve, then it becomes chronic. I personally think that it is the most sensible lens through which to view all kinds of things. Like, I wrote an article on SIBO as an adaptation, which it just makes sense to me. So people have all these, SIBO, some people are just miserable from it. But in so many cases, the attempt to just kill the bacteria don't work. It just comes back. Yeah. Even when people are doing everything right, they're eating the right foods, and they're taking all the probiotics, and they're taking the supplements, they're doing everything they're supposed to do, but it comes back. All right, we got to think about it different. Like, what if it's back because those bugs were doing something? Those were an attempt of the body to reestablish what was not. And if we don't reestablish what those bugs were trying to do, then Of course the bugs are going to come back because that's what bodies do.
Right.
So
Right.
it just makes sense to me that, I mean, if cancers are not uncommonly showing up as stage 1 and stage 2 and then resolving on their own, well, that doesn't make sense in the typical cancer model because cancer is an uncontrolled growth of cells. So why would the cells grow uncontrollably and then decide, okay, we're not going to grow uncontrollably anymore?
Right.
Doesn't make sense. But if we understand that cancer is it's there to do something, then it totally makes sense. And in fact, when they have done analyses of the genetic mutations that happen in cancer cells, they're not random. They are directed mutations. They are absolutely not a random set of mutations.
Yeah.
So, well, duh, you got to turn some switches on if you want to get the cell to behave a certain way. And then if you don't need that behavior anymore, well, turn the switches off. It's just that if that process is allowed to happen for too long, eventually the switch gets stuck and you can't, it won't turn off anymore. But I think, especially in the early stages of cancer, I absolutely think that there's an adaptation component to it, and that it's simply if what the body is trying to do through that adaptation doesn't get done, then it just progresses.
Yeah, thank you for that. That was really beautifully said. And I think that aspect that's what sets our profession apart, leading thinkers such as yourself as well, really putting that thought process out of, we shouldn't be at war with ourselves and what those internal processes are, right? We need to listen more and really, it's guiding us in a certain way of like, there is inherent wisdom in our healing ability. And if we can really tap in and follow that thread, I think it will lead to a lot of breakthroughs in medicine. But if we continue our at war, we're attacking and along those lines, that just seems to take us further away from the goal, which is that homeostasis and or thriving, right? So, kind of my banner of what I'm waving these days is healthcare to promote thriving. And this is definitely a huge piece of it. I want to thank you for taking the time. I want to have you back and talk about your book when that comes out too, Dr. Nigh. That would be great.
Yeah, I'd love to.
I'd love to help get that word out. And I'm super excited to catch up with you soon as well. I want to thank you all for tuning in to What the Health. Some really awesome stuff there. We're going to have to unpack that over the next few weeks. And we'll get Dr. Nigh back on here to share that. I mean, he's just up doing amazing things out there in the world. So thanks, Dr. Nigh. And how many people, how can they find you?
The website is the easiest, immersionhealthpdx.com. That's the easy way.
Good.
And they can, people can schedule and everything through there. So. And
do you do remote consults for folks as well?
Oh yeah, absolutely. All the time.
Awesome. Yep. Yeah. So please, this Dr. Nigh is one of the leading thinkers in cancer care and just in people care. And, as you heard today, we got all over the place, but it kind of comes back into a discussion of, how health happens, how our bodies work. This is just some far out stuff and love it. So thanks for tuning in.